This closing session is really about how to tell your story about your work and get that message across when your work may involve very disparate audiences that need to become advocates for what you're doing and understand what you're doing and why it matters. So we've got a really fantastic panel that I'm going to briefly introduce and then just get out of their way. Our moderator is Dan Gorenstein. He is the founder and executive editor of Trade-Offs, which many of you probably are subscribers already to that podcast. And if you are not, you should be. It's a great podcast, and he set the vision for the organization's journalism and strategy. Before Trade-Offs, he was a senior healthcare reporter at Marketplace and spent 11 years at New Hampshire Public Radio. He has a long set of experiences in journalism prior to that and has received numerous national awards, including the Society of Professional Journalists Sigma Delta Chi Investigative Reporting Award. So he'll be moderating this panel of 4 great faculty members who have been leading work that might have some controversy. Dr. Marilyn Thomas, next in line, is a social epidemiologist investigating the mechanisms by which structural racism contributes to Black, white, and other racial inequities in health. Not controversial in today's world at all. She specializes in developing adequate measurement of structural racism and statistical methods to capture the relevant mechanisms, including policy effects and causal inference approach in the absence of randomization. So she is a nerd's nerd. In 2022, she received a National Institute on Aging K99 ROO, also known as a Kangaroo Award, to study the impact of historically Black colleges and universities on late life cognition in Black adults. Next to her is Dr. Marisa Raymond-Flesch. Dr. Raymond-Flesch is an associate professor of pediatrics in the Division of Adolescent and Young Adult Medicine and at the Philip R. Lee Institute for Health Policy Studies. Her research focuses on health and healthcare access of California's Latinx and immigrant populations, with a particular focus on mental and reproductive health, not controversial at all. Her current projects span a number of areas, including investigating the use of psychedelic-assisted therapy for the treatment of anorexia nervosa, really not controversial. Clinically, she practices adolescent and young adult medicine with patients 12 to 26-year-old, including treatment of depression, anxiety, eating disorders, providing contraception, and providing primary care for patients with complex medical and mental health conditions. Lisa Kroon, next in line. Dr. Lisa Kroon is a professor of clinical pharmacy in the Department of Clinical Pharmacy here at UCSF School of Pharmacy. She was chair of the Department of Clinical Pharmacy for 10 years and is the Assistant Chief Pharmacy Office of Assistant Chief Pharmacy Office of Clinical Innovation, Education, and Research at UCSF Health and oversees ambulatory pharmacy practice. She got her Doctor of Pharmacy at the University of Michigan and did residency at UCSF in pharmacy practice, and then we got to keep her here, which has been our gain and Michigan's loss. And she practices in the UCSF Health Diabetes Teaching Center and is co-director of the UCSF Health Fontana Tobacco Treatment Center. Her research interests include evaluating the impact of pharmacist provider status and expanded scope of practice, not controversial at all, and diabetes therapeutics, tobacco cessation, and innovative pharmacy practice models. And last but not least, Dr. Jennifer James is an associate professor at the Institute on Health and Aging in the Department of Social and Behavioral Sciences in the School of Nursing and in the Bioethics program at UCSF. She's a sociologist and Black feminist scholar who conducts community-engaged qualitative research on racism and health. So we're just going with the controversy theme. Her current work is focused on the experiences of health and illness for people who are or have been incarcerated. So this is going to be a great conversation. Take it away.
Thank you.
Thank you very.
I think you're on.
Oh, okay. You guys can hear me all right?
You're on.
Awesome. Thank you very much for the introduction. And look, this is the end of the day. I can get a little tired, so I'm just going to say good afternoon.
Good afternoon.
A little more energy, people. Good afternoon.
Good afternoon.
Thank you very much. As you heard in the introduction, a lot of the word controversial came up a bunch. What I would say, though, another way to reframe this is to say it's essential research, right? And so the question, the challenge, the opportunity is how do you make sure essential research is heard by as many people as possible? That's really what this conversation is about. And it's a conversation with 4 super cool, kick-ass experts up here, which is really great. And we've had some background calls. We are ready to talk with you about some lessons learned. And hopefully, these are lessons that are going to be useful to you all too, because you all probably also are doing your version of controversial, essential research. And I'm hoping at the end of this panel, more people will feel more empowered to figure out how to make sure their work is heard by as many people as possible, which is, again, the point of this conversation. So with that said, I'd like to dive in, and I'm just going to, again, because I'm just feeling the energy in the room, let's give a nice round of applause to 4 people who are spending some time giving you guys some lessons. Great, better energy, I like it. Okay, so each of you has done some work on what people consider controversial. You've also learned over time how to talk about your work in ways that make it more likely that your audience will listen. Marilyn, I'd like to start with you. You were at Berkeley, the other side of the bay. I'm from Philadelphia, so I'm not sure of the geography. But
The hop skip, across the pond. Is what
across
we
the
kinda call
pond,
it.
okay. So you were at Berkeley working on your doctorate, and you presented your findings, and you started getting some pushback. Can you tell us the story, please?
Yes. Okay. So one of my dissertation aims was to study self-reported racial discrimination and its association with basically accelerated aging in a cohort of Black women, midlife Black women. And I was in a doctoral seminar, and the advisor to that seminar was an OG, like racial disparities researcher. And as I'm presenting, at the end of it, he basically looks at me and tells me that my study is completely wrong. My methods were wrong, particularly because I didn't have a white reference group. So it couldn't be health equity research. And so I basically had like 3 options, right? Like I could just get enraged and pop off. I could go back and like rework my study to be more appeasing, or I could double down on my work. And in that moment, I'm a lowly little, like, third-year dissertation student, or PhD student, I decided to double down. And I basically, well, part of the reason is that I knew that it was quality work. I had spent so much time doing an epidemiologic systematic review. I was integrating social theory. I was developing a causal framework. I was formulating really rigorous hypotheses. I was thinking very deeply about the study population and the measures and the methods, and I knew it would stand up to scrutiny. That's in part why I think I went to Berkeley, because I wanted to make sure, as a Black woman studying racism, that my methods would stand up. And so I basically just started in on a diatribe about how innovative my work was. And I talked about how the prior work that was done before me was really important, but had a lot of limitations. For example, self-reported racial discrimination as a measure isn't necessarily something that racial discrimination is not an experience that is ubiquitous across all racial groups, right? Black women would experience racism different than Hispanic women, which is different than Asian women. And so to have a measure that that's not culturally sensitive or relevant. It didn't make a lot of sense to me. I thought you could have a little bit of what we call exposure misclassification, mismeasurement of that exposure. So that was a problem. And I laid out a bunch of problems. I was making my case. But basically, I was advocating, I kind of said the reason why we want to use, or I wanted to use within group, a within group cohort, meaning a cohort of that high-risk group and not have a comparison group, is that's the way that you find sources of resilience that are culturally relevant for that group. And I made some other points, and then I kind of closed with, and this really builds on the work that you essentially helped create. And at the end of that And then at the end of that conversation, I'm happy to say that he now not only accepts the within group methodology, but he promotes it among his other scholars, rising scholars that he teaches.
I'm just a journalist here, so when you talk methodology, I get lost in some of these details. I suspect a lot of the people in the room follow that in a really deep way as scientists, as doctors. But I'm just curious. I'd like to go back for a second, Marilyn, to this moment. This you made a choice. You said you had 3 options. You could have popped off, you could have gone back and redone the work, or you could have doubled down. Can you slow down and help the people in the room understand how and why you made the choice you did, without getting back into the methodological details? I'm not asking you to go there. I'm just asking you to, as a human being, why did you choose the choice you made?
Thank you for that question. I think that when you put as much rigor into your science as we do, it's not that we're not ready for the pushback, it's just you're just ready to defend it. And so when I got that pushback and I knew how valid my methods were, I knew how I just knew how well thought out it was, including thinking about all of those biases that can come in my research question, in my methodology, and all of that. It felt like I was given the opportunity to turn this into a teachable moment. I understand that prior researchers or seminal researchers they introduce us to the field, but we, as rising scholars, are expanding that science. We are advancing the field by coming up with new ideas and everything. So instead of it getting under my skin, because it did, it pissed me off, but it was also okay, now I have a chance to actually speak to an entire room of people about why this methodology should be understood, utilized, and disseminated.
And on some level,
so it was teachable.
Sorry. Yeah. And on some level, did you sort of know and see that instantaneously?
No, I was thinking it in my head when I was doing the work, when I was developing the methods and the study design. I was like, this is so good. This is so smart for so many reasons. And I was getting feedback from my committee and everything. It was oh, this is so I like how this improves upon some of the gaps and the limitations in the previous methods. So I was really excited about it.
Final question before we move on. I really appreciate you sharing the story, of course. It sounds like ultimately, and you said this, but I just want you to kind of highlight this for us. It sounds like at the end of the day, you felt the pushback, you saw options, but when you decided to double down, you did because you actually really trusted yourself. You trusted the work, you believed in yourself, and you went with your work.
Yes.
Can you comment to that?
Yeah, I'll just say one of the lessons I learned from that is that innovation will often be met with resistance, because there's an instinct, right? You're doing something no one's really done. People don't really understand it. And oftentimes, new ideas sound good in the ether, right? But then when you actually go to implement them or introduce them, people are like, whoa, 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 wait, what? Wait, whoa. That's not how we do it. We do it like this. And so the first instinct, that resistance that you get, is normal, and you should be prepared for it. And so now what I learned from that is the more innovation that I introduce, the more prepared I need to be to defend it, and be calm. Don't get upset when you do get pushback, because that's required for that dance to expand the field, right? It's elastic. It's not going to be easy. So I don't know if that answered your question.
It does very much so. Thank you so much. Okay, Marisa, let me pull up the question. So you do work on psychedelics. You're conducting a clinical trial to test psilocybin for anorexia. You've taken a number of steps to be as inclusive as possible and invite people into this work. In the background calls we've done, I've been really, each time you've talked about your work, I've been really taken because of how intentional you've been in you've anticipated pushback, and you've taken very intentional steps to, I wouldn't say combat the pushback, but to invite and hear the pushback. Can you tell us a little bit about your journey around this, please?
Yes. So this clinical trial was not something I ever thought I was going to do. But I'm an adolescent medicine doctor, and you guys have probably heard about the mental health crisis happening for teens and young adults in the United States. And my patients were dying, and I needed more tools for them. And so this clinical trial arose from my research, from my clinical work, and my desire to sort of leverage my power and privilege as a researcher to help my patients. But the moment that I thought it into being, it was no less than a threat to my own identity. I am a health services researcher. I don't run clinical trials, but also I'm a Mexican-American woman who grew up during the height of the war on drugs. I was DARE Student of the Year. Do you guys remember DARE? I had a T-shirt. I wish I had a picture, right? I mean, I thought about this, and I was like, someone should do that. Who's gonna do that? And I called Claire Brindis, right, much beloved in this room. I literally crying, saying I have no idea what I'm supposed to do. I thought of this thing. Am I gonna do that? Is that something I can do? And so even from the very beginning, as I was communicating about this trial, I recognized how hard it was for me to even hold it. And I now go into all of my conversations with many different groups of stakeholders with the assumption that they are going to want to hot potato this as fast as I did. And with the assumption that it will bring ease to the conversation to acknowledge that from the very beginning. And so this has required a lot of different stakeholders to bring this trial into being. I've had to reach out to a number of collaborators across UCSF to convince them to do this. I had to sit down with the department chair of pediatrics and tell him I was going to give psilocybin to adolescents and young adults. That was terrifying. He was like, oh, I read about that in the New York Times. It's fine. But I have also, the NIH isn't funding this work, and so actually the way that we're funding the trial is through philanthropic funding. And so I've had to sit down with a lot of philanthropists and families and talk to them about this trial too. And then we're also looking for a really diverse group of stakeholders and a really diverse group of participants. So we've established advisory boards. We've been reaching out to people from different communities, not necessarily the communities that you're picturing when you think of anorexia, but the communities that I see in my clinical practice and the diverse patients it affects. And I know that it will be even harder for patients from diverse backgrounds to come into this trial for the same reason that it is so hard for me as a Latina to think about doing the trial. So every conversation I have starts with, let me tell you, I was DARE Student of the Year. Do you remember what that is? I never thought I was going to be doing this, but let me tell you why I am.
Thank you. I didn't want to interrupt you, but I was about to interrupt you. Why do you start by saying, I was DARE Student of the Year? Why do you tell people that?
I mean, I think that we felt the tension.
Well, also, can you bring this up?
Oh, sure. I think we felt the tension ebb in the room a little bit when I said that, right? There's like an injection of laughter, like the discomfort gets to, like, people get to start moving through it. And I think they also, there's this shared human moment of like, what the hell are you doing? Like, what are you doing, right? And the craziness of the idea. And then I can begin to walk them through the science.
Do you think by this admission and having the laughter, having the human moment, this, like, as you just were saying, like this kind of like this craziness, do you think that helps almost instantaneously help people trust you?
Yeah, well, I think it helps them realize that I have really thought this through, right? It helps them understand, like, the distance between 5th grade DARE Student of the Year me and the UCSF scientist who cares deeply about their kids and keeping them safe. They understand, like kind of instantaneously, they understand that there's this huge gulf between those two places, and that the science and the suffering that I'm trying to alleviate is what's between them. And so I think it builds trust. It makes room for them to want to hear what connects those dots.
And one final question about this before we go to Lisa. What's a nice example? Like with Marilyn, she said that the faculty member who initially gave pushback ultimately changed his tune and began to incorporate this new methodology. What's a sign for you that your approach, being so human, being vulnerable, has worked?
I think early in this work, when I was starting to fundraise, I was meeting with a family who has supported our program before, and I was telling this mom about this journey that I had taken, and about this question that I wrestle with: how can I use my power and privilege to help the people that I care for? And I think the first thing that she did when she was looking at my slides and looking at me is she just put down her pen and pushed her piece of paper away and leaned in. And then at the end, when I was done, she said, I know that you think that I'm someone who has power and privilege because we're sitting in this room for the reasons that we are, but I have no power and privilege to help my daughter. There is nothing else that I can give her that I haven't already tried, but this is power and privilege, what you're leveraging, and I want to figure out how to help you do it, right? So there was this shared moment of we had both been on this really long journey. Mine was about coming to terms with doing this study of thinking about everything that I could do for my patients, and hers was about her daughter and everything that she could do for her daughter. And we were landing in this same place at the end of those journeys of having this shared mission of trying to come up with more treatments for kids who suffer in this way.
Final thing. I know I said that was the final one, but what's the lesson that you'd like to share with the people in this room right now?
I think that being vulnerable can be really useful as a researcher. I think we have to say when we don't know, of course. But I think it's also okay to I think that people understand our science better when they understand how we've come to it. And what are the questions that are driving that. And I am not afraid to share those more human parts of my story. Maybe it's partially because I'm a qualitative researcher also. But I think stories have so much power, and they can really draw people into the work to then walk with you through the more complicated science.
I'm just writing this down because that was really good. I just want to say it again. Understanding that audiences can understand our science when they understand how we came to it. And if you all write anything down, I hope you write that down. As a journalist for 25 years who's interviewed a whole lot of academics, that step is so often not taken. And when you do that, you tell a story, you make yourself human, you take power, right? There's so much power. People really, you and I were joking right on the stage for a minute there. You were, as we were talking about color, and you told me, oh, those aren't blue, and I just assumed, I just have so much deference for an academic. I'm like, oh, I must be stupid. I must be getting something wrong about these colors. And I think one of the things I'd offer real quick here before we move on to Lisa is to just, as the non-academic in the room, there's so much deference. I'm like so psyched and ready, and without even realizing it, give to you. You all have so much power. What do you do with that power? How do you use that power to invite in, not keep a distance? And so I just want to share that. Anyway, that said, Lisa, let's go to you. As was said in the introductions, you're a pharmacist. You've seen how some people in the medical field are unsure what pharmacists do. In particular, the pharmacists, most of us interact with the folks behind the counter at Walgreens or CVS or Rite Aid or wherever. Based on reporting I have done myself over the last 10, 15 years, I've seen people dismiss pharmacists and look down on them. I know that hasn't been your experience, but I've reported on that. What lessons have you learned, Lisa, about how to communicate when you've encountered this kind of, whether it's ignorance or bias?
Yeah, thank you. So I'm not going to talk about a particular research study that I was part of, but more that we have a broad body of research demonstrating the value of pharmacists in any practice setting, from acute care, ambulatory care, and even in the community pharmacy setting, which is really where, Dan, what you were getting at there. And despite all of this, we have, as a pharmacy profession, made much slower progress than we'd like to payment reform, so that we get paid just like our physician colleagues. I see some of my close colleagues in the room here, nurse practitioners, PAs, et cetera. It may be a surprise to you that on the federal level, we are not recognized as, quote, healthcare providers. So we're not able to bill like our physician colleagues that we sit side by side and treat patients and medication management. So a couple aspects there. So you mentioned kind of your pharmacist that's in a chain pharmacy. I won't name specific ones, but they are the face of pharmacy. We know that. They're actually trained just like I was trained. They have doctorate degrees. But they aren't given the opportunity to use their skills, what we say practice at the top of license, because we're in a catch-22 right now. So why have we not made progress on payment reform, either on the federal or state level? It's because our medical professional societies see this as a scope of practice issue. So I'm even though it's on my bio, maybe I need to remove it, Joanne. But it's really practicing the top of our license using how we're trained to. And so a couple stories here. So in my advocacy work for several decades, and to your point too, just being a UCSF faculty member, we have a platform, and people listen to us. And so I've tried to use that platform to really advocate for our profession. One example was about 10 years ago, one of the bills that we had at a state level was to have pharmacists be able to prescribe medications to help people stop smoking. And one of them was prescription medicine and varenicline. So I'm on the call with some staff members from a medical professional society, and they're telling me how the medication works. And they were inaccurate. And I said, I have to stop you right there, but that's not how this medicine works. And the medicine at the time had was called a boxed warning about some neuropsychiatric symptoms. And so the staff said, well, if a pharmacist going to prescribe this, the person should be under the care of a psychiatrist. And I said, well, that's not required for a physician to prescribe this, a family physician, primary care physician. So that was just kind of oh gosh, we have some work to do here.
And real quick, just what do you mean we have some work to do here?
That we have to educate people around just what pharmacists do. So that's sort of depending whoever I'm talking to. I find I'm still 30 years after being on faculty here, still sharing what pharmacists do, because unfortunately the face of pharmacy is what you see. And they're not doing what they actually could be doing because they're hampered right now by some workforce challenges and payment reform challenges. So I am, I keep, what I've learned though is, of course, know my audience and really do my homework before I meet with them. Just today, we have a bill right now in California that would change the pharmacy practice regulatory model to be the same as what physicians and nurse practitioners have. And sure enough, the CMA, the Medical Professional Society, came out and doesn't like it. So I'm preparing comments to refute kind of some smokescreen arguments. So just really doing my homework, learning really who am I talking to. Is it a legislator? Is it a staff member from a medical professional society? Or maybe it's even a colleague of mine at UCSF that's never worked with a pharmacist.
And Lisa, I really, obviously, on behalf of pharmacists, you are fighting the good fight. You've been fighting this fight, as you point out, for 3 decades. You continue to find bias and ignorance in all corners. And I think with an eye towards the people in the audience, I'm really curious how, I'm also thinking a little bit about Marilyn here too, how do you find the patience? What do you say to yourself? How do you kind of deal with this and not like want to pull out your hair and say, screw you guys?
Patience is a quality of mine, absolutely. But moreover, I mean, a lot of the advocacy that I'm talking about really is not going to change my practice in a health system. The opportunity is in our community pharmacies. We have untapped resources.
Wait, hold on. No, I'm going to interrupt you right now. I'm not asking you a policy. I'm not asking you a structural question. I'm asking you a human being question.
Yeah.
How do you emotionally and intellectually cope with the, I'm sure, frustrations that come with the fact that you have to have the same conversation again and again, day after day?
Because it's just nothing new. And I've learned that I'm going to have to, every time I meet someone, I know I'm going to have that conversation.
And I'm guessing you believe in what you're doing enough that you are able to find the patience to do it because of your conviction in what you do.
Well, absolutely. And you mentioned innovating. Okay, this is what I could sit back and say, hey, health system pharmacy, we got this. But that's not what I'm about or what our school is about or our health system. We want to continue to innovate, and we have an opportunity. So I will keep fighting the fight for the rest of my career. Yeah.
Fighting the fight, believing in the mission. Very good. Jen, we've got about 10 minutes. I'm excited for your story. It's good. It's very good. It's also pretty personal. And you were giving a talk recently, and someone in the audience took exception to what you said. Can you walk us through what happened, please?
Sure. Hi, I'm last, so that's a thing. I'll just start by saying that I think I'm similar to a lot of folks here. I resonate a lot with Marilyn's story of, as a graduate student who was like doing a dissertation on Black women, being told like, you have to include white women. What are you talking about? So these same kind of pushbacks. Yeah, exactly. A lot of my research, a lot of my talks are ended with like, medicine is racist, healthcare is racist, the academy is racist. People don't love that. So it's not, I'm used to the idea that my ideas aren't popular. I study incarceration a lot now, and a lot of my talks are like, we need to abolish prisons. People don't get that. People don't like it. And I also like to talk. I'm a nerdy know-it-all who loves to tell people what I know. So I talk a lot, which means like I have a lot of experiences of people pushing back in various ways. I'm often the person doing the like lovingly calling in someone I think is wrong. And I do think that's a lot of where we learn, right, is in that like back and forth. It's why I love to teach, is I love being in dialogue. But that doesn't mean it's always easy. And yeah, a few weeks ago, since I agreed to be on this panel when I didn't really know what I was going to talk about, but things present themselves to you, I was speaking at an event, which I'm trying vaguely to anonymize, but some of you were there. Anyway, I was speaking at an event that similar to a type of event I do a lot, which is that there was folks who have a lived experience of incarceration who are sharing their stories of healthcare inside. I was asked to speak on a panel after this event, and usually when you speak on that kind of panel, it's obviously really different than giving an academic talk at a conference. It's different than talking with policymakers. I often see that my job in this, you're sort of put on it as an expert, which as others have talked about is weird, right? You sort of are, I always feel it's like, this is my opportunity to like use my power for good instead of evil. I've been ascribed a level of expertise that sometimes feels unfair when there's people who've lived something who are there talking already. And so it's this weird thing where you're trying to talk about your research, bring in the data, bring in history, bring in policy. And often I see my job as offering a form of validation or legitimization of what other people have already said was their truth and their experience. And so at this event, I was on this panel. I said a lot of things. I don't remember most of them, but I know I talked a lot about how, people who are incarcerated are sicker before, during, and after incarceration. I said that I think prisons are racist institutions, that they came from racism, just like I think medicine is a racist institution that came from racism. I think that there are really awesome clinicians working inside these environments at a really, really hard job that is structurally violent for them too, and there's a lot of burnout. But I also spoke about some recent specific issues with really bad clinicians, people who took advantage of the situation to do really abusive levels of care. And it was fresh on my mind. I'd just been to an event where people were sharing stories of being abused by their doctors, and I mentioned that. And importantly to the story is I talked about how I don't think prisons and jails are sites for healing and health, that they're structurally violent, and that I think these institutions, the standard of care of prisons and jails is neglect. I think they are bad for health. So after the presentation, after the panel ends, I'm chatting with people. Someone comes up and wants to talk to me, and they work in corrections. It's someone who I knew who they were. They did not remember me. That's fine. And I was excited they wanted to talk to me. I've worked with a lot of folks in corrections on, collaborated in different ways. They started asking me questions, and I quickly realized they were not happy with me. And they asked me a lot of questions that I didn't realize until later were trying to sort of challenge my knowledge, right? They asked me if I'd ever been inside, which I had, if I'd talked with folks who work in corrections, which I had, if I talked with leaders inside of prisons, which I had. So really not believing that the things I said were true or appropriate to what care looks like in prisons and jails. And they ended it by sort of saying that the way I spoke and what I said was irresponsible. And so this happened. And fun fact about me, like I think probably a lot of other high-achieving, former gifted and talented kids in the room, like I have anxiety and depression and maybe some other things that were never diagnosed going on. And anxiety is a weird thing where you can have the same conversation and you're fine and it's great, and other times it hits you, and this hit me and it wrecked me. And my anxiety, at least probably others, if you have dealt with anxiety or panic, it's very embodied. I immediately was there was a buzzing in my ear. I could not focus. I had instant brain fog. I was talking to other people in the room. No idea what happened in those conversations. It really hit me on so many levels. I didn't sleep for several days after this conversation. I have shaking, sweaty palms. I feel things in my stomach. My stomach was very upset for a long time. And I had a few sort of immediate worries that I was working through. First of all, I just don't like when people are mad at me. That's not fun. So that's a base level. But I initially was like, oh no, I was brought here, in support of a community organization of community members. Did I mess things up for them? Am I going to make it harder for them to have other events? Did I ruin something for them in some way? The person who was talking to me is a collaborator with some of my collaborators. Am I going to mess things up for my colleagues because I'm going to tarnish their reputation? Did I tarnish my own reputation? Is this going to disrupt my relationship with my colleagues or interfere with my ability to do work inside different institutions? But fundamentally, this idea that I was irresponsible, I think a lot of what anxiety does is when it hits you is when it plays on things you worry are true about yourself. And it made me think I'm someone who, I think like a lot of us, and whether this is healthy or not, like my research, my work is really core to who I am and how I see myself. It really, really matters. And so the idea that maybe I don't know something, maybe my methods aren't sound, maybe I, didn't do my due diligence, like really hit me and made me feel like what is my value? What am I doing here in ways that are really hard? And I'm privileged in that, like, I am in a moment of having a therapist I really like. Not always the case. I had people I could talk to about it. I have a lot of colleagues I talk to about it. And what was interesting about that is a lot of what my fantastic colleagues who talk to me about this would say is like, something along the lines of like, that's how you can tell you're winning is when you get pushback. Like, of course they disagree with you. They're working in a system that you're critiquing in a way that I was like, I can see why that's true, but didn't settle me. And so wait,
I'm sorry.
Please.
I just want to like kind of,
Go for
also,
it.
I'm looking at the time. We've got
Yeah.
a couple minutes before it starts Q&A, so I want to kind of like get at this.
Yep.
You were freaked out,
I was freaked out.
and one of the things you did was you went to your colleagues for support.
Yep.
And you're glad you did that, but it wasn't enough. Is that right?
Yes.
And so you did what?
Well, so I think, there's a way that academia, and being, especially doing public scholarship, I think privileges people who have a thick skin or can let things roll off your back or have a certain type of personality where you're like, love me or hate me, I just am who I am in a like Real Housewife kind of voice. Like, and that's not me. And so I think that there are a lot of people who feel confronted or like, I shouldn't give talks or I shouldn't research bad, controversial subjects, or I should, make sure everything is really grounded in science. I'm not speaking off the cuff. And that people who are able to speak like that, I think, are the people who are able to brush things off as like, they just don't get what I'm doing. This is good. When they start to resist you, that means you're getting somewhere. But for me, like what I needed to do was really, really examine really closely as much as I could what I said, which of course I didn't remember because who remembers what they say ever. And I had to try to find like, are there kernels here that I can do to think about moving forward? So how do I make sure that like, when I'm offering critique, I am being even more explicit than ever that I'm critiquing structure and systems and not people, right? How do I make sure that like I am clear about what is grounded in my research versus what's from the other forces of data versus what's from the media, about when I'm talking about history versus present or specific institutions versus broad. And so how do I bring that in? And I think, so that's sort of what I really had to think about, and then think about how do I think about individual people. And I think a choice that I made that I think is maybe weird is like, I really felt like I should apologize to this person because I did hurt someone's feelings. And like, that's something that I think is, for me, like a critical point for my ability to like deal with myself is like, dude, I feel like I did everything I could do to protect people's feelings in the moment, which I think is hard.
Jen, can you talk about this? Like, why did you take, I mean, I know you just alluded to it here, but like ultimately, what was the calculation in your mind about why you decided you wanted to apologize to this person?
Yeah, I think I think I believe everything I said to be true, like my truth, right? There's no capital T truth. We talk about qualitative research, right? I think that what the points that I was trying to make felt true to how I understand these systems and the role they play in our society. And I can recognize that I could have said things in a way that maybe didn't hurt people, and like that I can't be accountable for everyone's feelings. There's a million people in every room. I don't know how all of you are feeling right now. I can't take that on. But if I do something that causes someone pain, I feel an obligation to learn from it. Like, and that's part of, that's why I think a lot of us go into research is we like want to like make the world better. We want to alleviate suffering. And it's hard for me to think about causing it. And so it's a tough thing that I'm still working through is how you balance like individual things versus systemic and structure and who might get left behind and hurt. And I think often it's invisible to us. I don't know who reads my articles or who sees something and what they respond to it. But when we know, it feels like the only way for me to make sense of it is on a human level. And me as a person, as Jen, who has whatever degree, like it doesn't matter. I don't like when I hurt people's feelings.
And final question here before we turn to the audience. And if people have questions, please start coming to the microphones if you do have questions. If not, we've got more questions to go and more stories to tell. What's the lesson you want to share with the people in this room from this experience?
I think the big thing for me is I think, now that I'm mid-career, right, I think there's a lot of like students and trainees, and I think everyone who knows me knows I like to talk. I talk a lot. Like this is one of 9 talks I gave this month. It was a busy month. And I think that there's an idea that people who do this find it easy, and I think I want to remind folks that a lot of people don't find it easy. That yes, it gets easier to get grants rejected and papers rejected. You do get used to it. Your relationship to these things change, but it's still really hard to put yourself out there. It's still really hard to go up and have a microphone and speak and not know what's going to come out of your mouth and have consequences. It's hard to have people who don't believe in your work, and that even if you get accolades and praise and advancement, the humanness is still there, and that's okay. And it's okay to both decide how you want to organize your career based on your tolerance for that, and also okay to say to take breaks and to do what you need to do to take care of yourself. It doesn't make you a bad scientist or a bad advocate if you struggle with speaking up when people don't like what you have to say.
Great, thank you very much. Questions? Okay, well, let's keep going, guys. What's a concrete step that you all have taken in the last 3 months to try and protect your work and the work of others in your field in the face of these changes we're seeing at the federal level?
I can start, is what I said. I also want to add a caveat to my comments earlier. I had mentioned that I went to Berkeley because I wanted to study rigorous methods. I want to qualify that because I have a secondary appointment here in EpiBio, and UCSF has one of the best programs on earth. I just want to say that. But I wanted to study racism as a social determinant, and back then, more than a decade ago, there were 20 researchers in the country doing that, and Amani Noor-Jeter was at Berkeley, so I was at Berkeley. In this climate, to study structural racism, it's kind of interesting because after the 2020 summer of the murder of George Floyd and Me Too and Enough and all of that, all of a sudden the academy was super ready to invest into racism research and social determinants and all of that. And so there was all of a sudden these funding opportunities and all of this cool stuff. And then it was okay for me to actually write a grant that said racism in the title, right? But now, after January and the executive orders, it's been weird, right? It's been not weird, it's been horrible. My grant is to study the impact of historically Black colleges and universities on Black health. It doesn't have any of the Control F buzzwords like inequities or gender affirming or anything that they're scraping. So I've been fortunate so far, and it hasn't been terminated or pulled. But what's also been really weird is on April 23rd, the Trump administration signed Trump signed an executive order promoting the advancement and funding and resources for HBCUs. Makes no sense. When you read the order, there's a lot that I'm reading between the lines on. There's a lot of language about student success and institutional budgets and things like that. And I won't bore you, but I suspect that the ultimate goal is probably to try and integrate HBCUs, possibly through funding restrictions and different things, but I digress. So it's been a roller coaster. It's January happened and the grant that I was writing for the next 5 years got scrapped. Then this executive order comes out last week, and now I'm reapplying. I'm revamping that grant because the whole focus of that grant is to look at what are the specific institutional characteristics within HBCUs that are actually driving some of the positive health outcomes I'm finding. So that's what I'm going to do. I'm going to piggyback on this nonsense as best as I can to try and advance this work, even if it means kind of skating on slime. Thank you. Yeah.
Skating on slime. We have 9 minutes. There's one question I really want to hear from all. Oh, there's a question. Oh, great. Fantastic. Sorry. Thank you.
Hi, everyone. Thank you so much. Hi, Marilyn. My name's Andrew Sudler. I'm one of the PGY4 psychiatry residents and public psychiatry fellows here in Maryland, and I went to grad school together at Berkeley. Had the same mentor, Amani Nurjeter, who's incredible. Thank you for being here, Marilyn, and for all the incredible work you're doing. And thank you to all of you. I had a question about, I was really struck by the comment around vulnerability and sharing stories and being able to connect with people, particularly about your work. And I was wondering if you all could speak to if, and if so how, you've maybe put yourselves in environments where you knew people weren't going to disagree with some of the work that you're doing, and how you prepared to talk about that. I work in the county jail now, and I'm going to be a forensic psychiatry fellow here next year. Everything you said resonates with me about our carceral system, but I also know that I'm in the minority feeling like that. But I also have realized that to do the work in changing that system and hopefully abolishing it, I need to be able to talk with people who don't agree with me. So I would love any thoughts you have about how you do that work thoughtfully. Thank you.
It's really hard. I mean, I think, you know, I don't know if I have great answers. I know that I talk differently with different audiences. I write differently for different audiences. There's different points I hold central and different types of arguments I make in different rooms. And I think that is a thing we all do, right? And so I think it's figuring out what is the core of the work you're trying to do, what's the core questions you're trying to advance, and how do you make those, how do you translate those to different languages? And sometimes that's disciplinary, right? The way I talk, if I'm explicitly speaking with clinicians versus social scientists is different, even if it's the exact same project. But I think that like there are, I can only do this work and only work in places and with people where I'm like, I know that fundamentally people here have some centralized same goal that I do. We want to help people. We want to solve this question. And finding ways to hold on to what that is. Oftentimes the how we do that, what that looks like, how we define these things are different. But for me, for often in carceral examples, it's often like ideas of like safety, right? That is a really paramount thing. How do we talk about safety in new ways? Are there new ideas of safety we can introduce, of safety for whom, safety for what? Are there different ways we can challenge ideas of what is unsafe or how it's unsafe? What is the evidence we can provide to counter those arguments that might not be the way I would frame it for me? It has nothing to do with why I think we need to change prisons, but sometimes there is something to speaking the language of the people around you. But I think it's a thing we all have to put our own boundaries on, is like, you know, what places can we work? What topics can we study? With whom can we collaborate? And I also think it's okay to decide I can't do work with those people, or I can't have these conversations there. Like, there is a core of like figuring out how to protect yourself so you can do this work for longer, and so how you can find allies in different spaces.
I think that I agree with everything Jen said, and I think there can also be an answer of like, I cannot do this today.
Yes.
We're all all of us are in this environment that's a really difficult environment to be functioning in, and I think, you know, to the bigger picture of your question earlier, Dan, like this idea that we have, you know, I'm going to get it wrong, but there's that Audre Lorde quote about self-care is its own act of radical defiance, right? So I think we have to pace ourselves and think about that, and think about like, where can we put our efforts right now that will move things forward in this one piece that we're going to do. And I think for me, it's sustainable when I know I'm moving some part of something forward, even if it's not, you know, if I can't change federal policy today, if I can change what's happening in the middle schools in Salinas today, where I have my longitudinal cohorts today, that is something that is deeply meaningful to those people in that community, and it is policy, right? So thinking about all these different levels where we can impact.
Just to follow up, though, on this question, and perhaps I'm misunderstanding the question, but I mean, Marisa, part of what you do is when you are in a room with people who you believe to be skeptical, if not downright hostile, one of the approaches you take is to make yourself vulnerable and talk about yourself, tell your story. I mean, does that, if you want to come back to the mic here for a second, do you feel like when you think about your job in the jail, do you feel like that's an option?
I think it depends, and it depends on our own positionality, right? As a black gay man in the jail, I have to move very differently through the jail than my colleagues who are white, cis, straight men, right? Who are given a different level of privilege and may be able to question structures in different ways that I'm not able to. But at the same time, I think I like the vulnerability aspect. I think I'm thinking partly about that. I like the do what you can here now. You don't have to do everything. But I think also in this current environment, I'm thinking a lot about what spaces do I want to put myself in, because I think we have limited time. Like, we all have limited time with our work. We all have a lot of competing demands, and I'm thinking about how do I structure my career to be in places where I'm going to get the most sort of bang for my buck in terms of being able to convince people that what's happening in our jails and our prisons is problematic, and that we have to have mass sort of movement to be able to change some of that.
Can I make a comment?
I think.
Can I? Oh, sorry. Oh, I just wanted to follow up because as much as we're talking about like how important it is to practice self-care, I also think an important tool to remember that we can use in being in those uncomfortable places and conveying our science to people that are hostile to it is to also think about them. And one of the tools that I use often is to disarm people in ways. So like, for example, I was asked to give, I don't know why they invited me, but I was asked to give a talk on structural racism in San Francisco at the Exploratorium with a special session for high-level donors. So these were people who were donating like a minimum of like $50,000 a year to the Exploratorium in San Francisco. And it's a private dinner and a thing, and they wanted somebody to come and talk to them about racism in San Francisco. So I'm in this room with predominantly white people whose houses are overlooking the Exploratorium. And I'm telling them, I'm showing them maps of like redlining from like 1937 to show them how their intergenerational wealth has disproportionately disadvantaged them and disproportionately disadvantaged people of color for generations in San Francisco. So being in that space, but I'm kind of a different bird. I like confrontation, so I like being in those spaces. I feel very comfortable in those spaces. In part because if anybody needs to hear it, that's who needs to hear this, is those of privilege. And the way that you're going to convince people of power to give up that power or redistribute that power is to make them understand how they will benefit from it. It will improve our lives, including yours, right? So I think we do have to practice self-care and think about how we feel in those spaces, but we also can use tools to disarm people around us, kind of like how you're talking about when you talk about the dare, like I was the captain of dare. Like that, in that moment, it does kind of, it makes it easier to tell people difficult things when they're a little bit more comfortable. So I just wanted to add that. We're talking about self-care, that's important, but you can also.
We thank you for that. We are at time. I want to respect people's time. I know we've got the reception, the poster session. I just want to, for those of you not keeping score at home, here are a couple key things. Trust in yourself, make yourself vulnerable, conviction in the mission. It's hard to put yourself out there, but humanness is still there, and how your audience that you're talking to who may not be receptive can benefit. Those are a couple key takeaways from this amazing conversation. Let's give it up for this incredible panel.